Do you remember when taking the stairs was just getting upstairs? Or when you planned a vacation based on the sights you wanted to see, you didn't have to think about how far you'd have to walk? Or maybe weekends meant getting down on the floor to build Lego castles with your kids or grandkids? Well, if those moments feel like a lifetime ago, you're not alone. There's a specific feeling that comes with chronic knee pain, and it feels like your world might slowly be shrinking. You start saying no to the things you love, not because you don't want to do them, but because you're afraid your knees just won't keep up. Today, we're going to discuss why toughing it out is dangerous and why the standard medical route often leads to a dead end. And most importantly, how you can get back your active life without going under the knife. I'm Dr. Michael Bell from Vitality Integrative Wellness, and we're here to help you find your path back to a healthy knee. It rarely starts with excruciating pain, does it? And usually your body starts with a little whisper. It might be that rusty hinge feeling when you first wake up in the morning. Maybe when you get up, it takes a good 5 or 10 minutes to kind of walk it off, or the stiffness takes a little bit before you can move around. It's a classic sign of inflammation. You might even be dealing with swelling and inflammation, and that's that warmth around the joint, and you can't think of really any time you've injured it or you really haven't done anything. Maybe you've had that unsettling sensation that your knee just might give out or it feels like it's gonna buckle, and it gives you that low-level anxiety with every step you take. Let's not forget the sound effects. Knees crunching, popping, or grinding. Doctors call that crepitus, and that's the sound of your smooth cartilage wearing down. So these aren't just annoyances that come with age. You can actually get them at any age. These are warning signs that it's like your check engine light on your car telling you that the joint is under stress and it can't handle it. So the problem is most people try to be resilient. They might ignore it. Maybe a grin and bear it attitude or taking that wait and see approach. Maybe it's gonna go away. But the hard truth is knee pain never really just stays in your knee. So when you hurt, you change how you move, you limp, you shift your weight, which now can cause your hips to become out of alignment, your lower back gets into spasms, and now you're dealing with a whole new set of problems. And sometimes the physical toll, even the worst part, it's the lifestyle cost. So that's the family moments you miss because you can't get down on the ground to play. It's the trips you don't book because you're terrified of the airport walk, or the gradual loss of independence. And that's what we call that shrinking, where your world slowly happens to get smaller and smaller. That can have an impact on your mental health and also your joy in life. You deserve better than that, and watching life from the sidelines is no fun. So if you're watching this, chances are you might have already tried to fix it. Maybe you've been down the medical route and you went to the doctor and they maybe offered you cortisone shots, or might even worked if you did the shots for a few weeks. But cortisone is often just a trap. It's a powerful anti-inflammatory that masks the pain signal, but it doesn't really fix the damage. And repeated injections can actually weaken tendons and accelerate the degeneration of your cartilage over time. Some people have even tried physical therapy. Don't get me wrong, PT is an excellent tool, but it has its limits. If your joint is bone on bone or structurally damaged, no amount of exercise is going to regrow or regenerate cartilage. You can do the work, have great strength in your knees, but you can still be in pain. And when all this fails, then usually what the ultimatum is a knee surgery. That can be a total knee replacement, partial knee replacement. Maybe it's a cleanup job where they go in and just remove some of that tissue that's floating around in there. This is a major event. It can be painful. There's usually rehab involved, and it's a risk that you don't want to take lightly. We believe you shouldn't have to choose between suffering forever or going under the knife. At Vitality Integrative Wellness, our focus is to bridge the gap for people who've tried everything. Our approach is different because we look at the whole you. We don't just treat the symptoms, we want to investigate the root cause, things like your biomechanics, your inflammation levels, and your tissue health. Our focus is regenerative and restorative therapies. So instead of cutting out damaged tissue or just numbing the pain, we utilize advanced non-surgical techniques designed to help your body heal itself. Our goal is to improve the structural integrity of the joint and reduce inflammation naturally. We want to help preserve your natural knee, not replace it. So imagine waking up in the morning without stiffness. Picture yourself booking that dream vacation without a second thought about the walking distance. This is the reality we help our patients achieve every day. You do not have to accept a shrinking world. If you're tired of treatments that don't work, and you want expert guidance on a natural path to recovery, it might be time for a second opinion that focuses on your health and vitality. So if you're ready to take the step towards relief, contact us today, book your initial consultation. We will help create a personalized care plan to help you regain your mobility and quality of life. We'll sit down, review your history, see if you're a candidate for one of our non-surgical restoration programs, and your knees and your grandkids will thank you.